This question is from Alondra R, and she asks, my first baby will be here soon. What can be used for breast relief? Alondra, I recommend 3 things for breast relief. First is to have plenty of breast pads. These are absorbent pads that help keep the breast skin dry and healthy. I recommend a nipple shield, or this is a small device that will put a barrier between the breast and baby while they're early in the stages of latching to kind of help facilitate breastfeeding comfortably. And then I also recommend a Philips Avent double electric breast pump. That's important to stimulate early milk production and sometimes even allow you to have a break from nursing if you need to for comfort. The double electric breast pump is very quiet, it's fast, it's customizable in order for you to have a comfortable experience with the pump as you are beginning to work with breastfeeding. This question is from Carrie E, and she asks, now that my 1-month-old is sleeping longer stretches at night, it seems like she's cluster feeding during the day. Is this typical? Yes, very typical. I hesitate to delay feeding when she's showing hunger cues because she tends to get quite fussy. Well, Carrie, she's doing exactly what she needs to be doing. Most 1-month-olds are preparing your body by cluster feeding. They're preparing your body to make more milk in the next couple of weeks as she continues to grow. Cluster feeding is very normal and natural. You want to respond to those hunger cues, but it can be kind of annoying when it seems to go on for multiple hours and sometimes you just need a break. So it's perfectly fine to use some expressed breast milk. I might recommend the Philips Avent Natural bottle, which is the most natural way to bottle feed. It has a nice wide nipple. The nipple itself doesn't collapse during feeding, so it's very easy to go from breast to bottle and back and forth without any nipple confusion. I might suggest that during the cluster feeding times as well, but certainly responding to her as you are doing is exactly what you need to be doing, and the cluster feeding pattern will usually stop as you get closer to 6 to 8 weeks. This question is from Lanasha E, and she asks, how much breast milk should a newborn take in a day? Most newborns are going to take roughly 20 to 24 ounces of milk in a 24-hour period. So this can be accomplished by 8 to 10 breastfeeding sessions in that 24-hour period, or maybe 1 to 2 ounces every 1 to 2 hours if you are bottle feeding either formula or expressed breast milk. This next question is, how much pumped breast milk should a 6-month-old be getting through a bottle when I'm at work from 8 to 5? He sleeps through the night from 8:30 p.m. to 7:30 a.m., which is awesome. Congratulations on my great sleeper. Most 6-month-olds are going to be taking larger bottles. They're going to be taking probably 4 to 5 bottles a day of anywhere from 4 to 6 ounces of expressed breast milk. With the Philips Avent double electric pump, you're able to get that milk out very efficiently, comfortably, and quietly in order to fill those bottles while you're at work during those 2 to 3 pumping sessions that you have during the business day. Most of the kids are going to have the larger bottle volume, so with the Philips Avent bottle systems you can have smaller or larger bottles, and also a Philips Avent anti-colic bottle has a special valve on the inside to be able to accommodate a more horizontal positioning of the bottle without getting air in the nipple. That's great for 6-month-olds because they're sitting more upright and starting to self-feed with that bottle, so the Philips Avent anti-colic bottle might be a great tool for that too. This question is from Marissa S, and she asked, how do you get your pediatrician to give you a referral for an oral tie evaluation or a tongue tie evaluation? Marissa notes that she wants to be able to breastfeed her 2nd child, but ended up pumping exclusively because breastfeeding was so painful with her first. Marissa, oral tie evaluations are fairly easy to get, and that starts with talking with your lactation consultants in the hospital. They're the first person that's going to be evaluating baby's tongue positioning and looking at how well you are working as a team. Remember that every baby mom pair is different, so just because that was the experience that you had with your first does not mean it will be the experience that you have with your second. So lean into your team of support in order to determine how you can have a comfortable breastfeeding experience. start with your lactation consultant, work with your pediatrician. They will look at the baby's anatomy, they will look at baby feeding, and maybe troubleshoot some other reasons that breastfeeding might be uncomfortable. And if they need to get an oral tie evaluation, most pediatricians and lactation consultants will lean into their local ENT or ear, nose, throat experts to think about getting a tongue release in order to make breastfeeding more comfortably. So please use your team. Go in with a positive attitude, and there will be many options for you as more ENTs, lactation consultants, and pediatricians are aware of tongue tie complications and willing to support that breastfeeding journey and make it most comfortable for both you and baby during those first few weeks. This question is from Naomi B, and she asks, is it okay not to pump and build up a freezer stash? I hated pumping with my first and would rather not do it again unless I have to. Naomi, absolutely. You do not need to have a freezer stash in order to be a successful breastfeeding mom. I have got many moms who go through an entire year-plus experience never touching the breast pump and never having a freezer stash. So it is okay. I might also suggest, though, that sometimes it's the pump itself that causes that discomfort and that problem. And so I might suggest a Philips Avent double electric pump that has a very customizable approach to nursing, stimulates the breast very comfortably, it's quiet, it's efficient. So maybe trying one of those new tools may allow you to have a bit of a stash, but certainly not required to be a successfully nursing mom. Here's a question from Danielle Harper Bennett. How do I get my 9-month-old to sleep through the night? This is the million-dollar question, Danielle. We all want our babies to sleep through the night, right? And especially a 9-month-old might be going through a sleep regression or maybe even their second sleep regression that's causing them to have more night wakings than we anticipate. I like to talk with my families early about sleep coaching and really encouraging self-soothing skills that an infant needs to learn. They need to be taught that. But in order to do that fairly, we need to offer them tools to self-soothe. This question is from A. Blandon, and they write, when should I introduce eggs, peanut butter, strawberries, and yogurt to my baby? I love talking about starting solid foods because the science of starting solid foods has changed so much in the last couple of years. And now any of these foods on this list can be a first food. First food should have lots of variety and lots of texture and lots of taste and lots of fun, and usually start between 4 to 6 months of life during that process. So talk to your pediatrician about what they recommend for your baby's timing on starting, and then once you do start, lots of variety, eggs, peanut butter, strawberries, yogurt, anything goes. Have fun with those foods because that positive experience with food is what's most important, and lots of exposure to prevent food allergy. This question is from Prin Lillo, who asks, when can I start pumping? Can I give my baby my pump milk from the first pump? Absolutely. Any milk you pump during those first few weeks of life should definitely go to baby. We don't want to be pumping off milk that baby needs. And I have many of my moms that start working with the pump as early as the first day of life when they're still in the hospital. They're working with lactation consultants in order to make sure that the breast pump experience is efficient and it's comfortable. The Philips Avent double electric pump is certainly one I recommend in order to get moms into a very comfortable position. It's very quiet, it's quick, it's easy to clean, and it's customizable with different settings in order to make sure that that experience is comfortable. Then as soon as we get that milk, that's what we offer baby. Talk to your lactation consultant about how they prefer giving the milk to baby during those first few days of life and as you're working with that pump. Good luck. This question is from Debs03, and she says, my baby wakes up multiple times from teething pain and takes hours to fall back asleep. How can you ease teething pain when the tooth has cut the gums and baby wakes up multiple times? This can be so tough because in the middle of the night, we really want to attend to our baby's pain and make them comfortable during the teething process, but we also don't want to create bad habits of intervention that baby's going to take advantage of and then disrupt their sleep cycle even more. So especially, Debs, in this situation, if your baby's truly having pain during teething, I might recommend using a pain medication, offering some infant acetaminophen or infant ibuprofen will attest and help with their actual pain from that tooth erupting. Offering other soothing tools like Philips Avent Soothy Snuggle is a great option too, to have that non-nutritive sucking when babies are having mouth pain. But teething should not make babies be up for hours. Address their pain and then coach them back to sleep. Because remember, babies are going to be teething for 18 months, 24 months. Like, we don't want to have their sleep be disrupted that whole time. So use soothing techniques, use your non-nutritive suck with your pacifier, use your pain medications when you need to, and then remember your good sleep habits to encourage them to go back to sleep on their own as soon as possible.